And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
And welcome to Boomer Life on CIL 650. I'm Joanne Sutton. April is Parkinson's Awareness Month, and on Boomer Life today, we're talking about the Parkinson's movement in British Columbia. What is the Parkinson's movement? We're about to find out. Everyone affected by Parkinson's deserves to have the latest tools needed to live the healthiest life possible for as long as possible. At ParkinsonSociety, British Columbia, their goal is to provide exercise programs specifically designed for people living with Parkinson's disease. Now, joining us in the studio today from Parkinson's BC is their CEO, Jean Blake, along with neurologist Dr. Martin McKeown. Thanks to both of you for joining us in the studio today.
Great to be here.
A pleasure. Thank you.
Jean, let's start with you. Can you tell us a little bit about your background and what's led you to lead the role at Parkinson's British Columbia?
Certainly. I've had about close to 12 years now working in nonprofits, including close to several years at Parkinson's and 4 years at Alzheimer's, 6 years at diabetes. And I think a lot of what I do is work to increase the awareness about the disease and the work of the society and the things that can help people live a fuller and healthier life while dealing with the issues that come about as part of a chronic disease.
Tell us a little bit more about what is the actual society. What is Parkinson's Society British Columbia? We know it's a nonprofit organization founded back in 1969. Tell us a little bit about what they actually do and how it works.
Yeah, we have a 1-800 line that's accessible throughout the province of British Columbia. And we talk to people, give them information, help them navigate some of the healthcare issues, give them referrals. We'll do longer-term consultations, and actually during April, we are launching a new short-term counseling service. We also run programs across the province, including regional conferences, a program called Voice and Swallow to help people deal with some of the issues that almost everybody with Parkinson's will have to deal with at some point in time. And we've really been advocating and trying to find ways to support people to exercise. Exercise shows that in most cases, you can better control your symptoms that come along with Parkinson's disease. And increasingly, research is also showing that there may be a neuroprotective impact. So actually, the whole population, we encourage them to get out and exercise. But our work is obviously targeting those affected by Parkinson's disease.
So how do you bring your message into the communities of British Columbia?
We have a network of 50 support groups across British Columbia. They're very active. They are led by volunteer leadership, and they get the message out there, work to support one another. They meet usually at least monthly, and often it's around issues, sharing how different people have dealt with particular problems that come up with Parkinson's. Also exercise. Many of our support groups have now launched an exercise component that goes along with meeting for support.
And how do you collectively work with the medical community to substantiate that message you're trying to get into to the public?
Well, they're really key. Obviously, a disease like this somebody can live with it for many, many years, and it needs to be a regime of that exercise along with appropriate medication and support from other healthcare professionals as well. So the exercise component is really key in terms of if you have health professionals like physiotherapists or even certified physical trainers that know about the issues that come along with Parkinson's, then they can design and provide exercise and treatment that is focused on Parkinson's issues. On the other side, the medication side, as you said, we've got Dr. McKeown here in the studio with us. The access to appropriate medication regimes and other treatment regimes that they can provide are really vital. And that's a really big issue. We've only got the Movement Disorder Clinic at UBC and one that started out in Surrey about 2 years ago. So access to those movement disorder specialists is a real problem for British Columbians living with Parkinson's disease. And so that's also part of our issue.
Absolutely, such a key issue as well. This would be a natural time to introduce Dr. Martin McKeown. You've got an interesting background. Can you tell us a little bit about what you do and where you came from?
Well, I'm a clinical neurologist with an interest in movement disorders, and I'm the director of the Parkinson's Clinic at UBC. In a former life, I was an engineer, so I have an active research program trying to help people with Parkinson's, and we often use engineering principles to try and assist people with Parkinson's.
That's great. Can you give us an accurate, but I guess a simple definition of what Parkinson's disease actually is?
Yeah, well, Parkinson's is a brain disease where one part of the brain starts to degenerate. And this results in many varying symptoms ranging from tremor and stiffness to slowness in moving and walking, depression, or even constipation and loss of smell. It typically affects older individuals, but we occasionally see people in their 40s or even younger with the disease. One of the characteristics of the disease is that it progresses very differently amongst individuals. Some people in our clinic are doing very well even decades after the initial diagnosis, and others have not fared as well. As for incidence, by next year we may be seeing as many as 200,000 Canadians with Parkinson's disease. The number will probably continue to grow as our population ages.
Those are staggering numbers.
They are. In 2011, it was estimated that 12,000 British Columbians had Parkinson's disease, although the number is probably substantially higher now.
So in your eyes, how do you see that Parkinson's disease could be managed?
Well, currently there's no cure for the disease. The best that we can do is to treat some of the symptoms and try and slow the progression of the disease. In my view, Parkinson's disease is best managed by a team approach, which includes nursing, physiotherapy, occupational therapy, social work, pharmacy, in addition to medical input. Medically, most of the treatments work on replacing the natural brain chemical dopamine, which is deficient in Parkinson's disease. There is surgery for Parkinson's disease, which is an effective therapy where essentially a pacemaker is put into the brain. But unfortunately, not everyone is a surgical candidate, and the waiting list for the surgery in BC at least is very long.
Wow.
3 years.
3 years.
Really?
Yeah.
Jean had mentioned a lot about the importance of exercise that the society is trying to promote. What can you speak on the exercise factor in the means of symptom control?
Well, it's certainly true that exercise is an excellent treatment for Parkinson's disease. We do know that in general, people who are more physically active tend to have slower progression of the disease and better symptom management. But the big question is, and I think this is still an open question, is what type of exercise is best? So there have been some things, for example, that have shown, for example, Tai Chi is very good for balance in Parkinson's. Probably, at least based on some research work, it probably has to have some sort of aerobic type exercise, enough to get you to sweat, to kind of stimulate some of the hormones that result in beneficial effects to the brain. We're certainly involved in a number of research studies looking at exercise as a treatment as well.
Excellent. So if somebody were sitting at home with a little red flag waving in the back of their mind and wondering if some of the symptoms and some of the experiences they're having right now at this moment in their life, and they're concerned it could be Parkinson's, what would some of those first telltale signs be, or warning signs?
Well, one of the early signs would be, for example, a bit of stiffness. So it's not unusual that we would see people presenting initially with what's thought to be a frozen shoulder, and when you look back, it's really because they weren't swinging one arm when they were walking. Very often it'll be the partner who will notice that someone is shuffling and walking, moving more slowly. Tremor is a common thing. Excuse me. And there's also been some suggestion that things like loss of smell may be an early sign of Parkinson's as well.
Interesting. So if someone is experiencing some of those symptoms, first thing they should do, go and see their doctor?
Yes, I think that would be highly advisable. So There are some things that may slow progression of the disease, such as exercise, so it would probably be beneficial to exercise no matter what.
It's wonderful. Jean, can you speak a little bit about the actual Parkinson's movement?
Mm-hmm.
We're in the middle of
Yes.
Parkinson's Awareness Month right now, and let us know what we can do and what's happening.
Great, thank you. So for April, Parkinson's Awareness Month, we've launched a movement, the Parkinson's movement. And it's really about starting where you're at, but to set a goal for yourself for exercise. It might just be walking around the block for starters. If you're already into exercise, just adding a little bit more, because as Martin said, you got to break a sweat for this to make a bit of a difference. We have on-site program to help people do that if they want to go on and register at Parkinson.bc.ca, and we would also be grateful if they want to turn that into a fundraising campaign for us. But the most important message is just get out and exercise. We have a community program that's being launched in about a dozen communities across BC, being led by volunteers, just people getting out and walking together, called Step by Step. So they can also check with us and see if that's something that has been made available in their community. And that's actually launching tomorrow, April 11th, World Parkinson's Day.
Excellent. And Dr. McKeown, are you involved with, how are you involved with Parkinson's Awareness Month?
Well, we like to support the Parkinson's Society of British Columbia any way we can. We routinely advocate exercise to all of our patients as they come through our clinic. Anytime we are asked to give educational talks, we're more than happy to do so. As I said, it's the Parkinson's community is a wonderful community. I feel privileged to be part of it, and I'm happy to do anything we can to support the Parkinson's Society of BC.
You're listening to BoomerLife. I'm Joanne Sutton. April is Parkinson's Awareness Month, and today we're talking about Parkinson's and the Parkinson's movement. Joined in studio with Parkinson's Society BC CEO Jean Blake and neurologist Dr. Martin McKeown, and we've just started the conversation. You can get more information. Please visit their website, parkinson.bc.ca. We'll be right back on BoomerLife.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.